Hi, I'm Dr. Craig Miller with Gahanna Vision Center. There's many tests that your optometrist will perform as part of your annual eye exam to measure for glaucoma, as well as to assess the risk that you or your family may develop glaucoma in the future. In most cases, glaucoma is a very preventable disease. The tests are designed to not only measure the glaucoma that may be there, but to assess the risk for future damage or future changes. One of the most basic things that you can do is fill out the basic patient history form. On this form, you can let your doctor know if there's any family history of glaucoma, or also if there's any systemic history of diabetes, high blood pressure, or cholesterol, because those will increase your risk as well. Also, be sure to let your doctor and your optometrist know if there's ever any changes in your medication or changes in your systemic health that may pose a risk for glaucoma. The most common test that your optometrist perform as part of your annual eye exam is measuring your intraocular pressure, or the IOP inside your eye. The IOP is the eye's natural pressure that's made when fluid is built up and then drained. This test is commonly performed using the air puff test or another simple measurement that the doctor can perform in the office. Patients with a higher IOP typically are at a higher risk for developing glaucoma. Another test that your optometrist will perform is called visual field testing, or it'll measure your peripheral vision. Using this test is more than just measuring your peripheral vision. It's also measuring the health and the function of the optic nerve and the nerve fibers. In glaucoma, when these nerve fibers begin to die off, it starts to take away your peripheral vision, or the blind spots inside your eyes. When your optometrist dilates your eyes and looks inside your eyes, he's evaluating the optic nerve. Looking at the optic nerve, he's assessing the risk for glaucoma or any glaucoma damage that might be there. Your optometrist will be looking at the color of the nerve, the health of the nerve, and the appearance of the nerve to tell if there's been any nerve fiber loss or damage. Many times, your optometrist may even decide to take retinal photographs of the back of your eyes. Using this technology, your optometrist will be able to document how your nerve looks, as well as monitor for any future progression. Other specialized tests that your doctor may perform as part of your annual eye exam. One test is gonioscopy. Gonioscopy uses a small lens made up of 4 little tiny mirrors, and using these mirrors, your doctor can look at the angle inside your eye. The angle is where the fluid drains out of. Patients with a narrow angle or a closed angle will cause the pressure to go really high and increase their risk for glaucoma. Another test that's becoming widely available is pachymetry. Pachymetry uses ultrasound to measure the thickness of the cornea. To fully understand what a patient's IOP is, the doctor will need to know their central corneal thickness. Patients with a thicker cornea will actually read a falsely high intraocular pressure, where patients with a thin cornea may be predisposed or higher risk for developing glaucoma. The main goal of glaucoma testing and management is to assess the risk and the health of the nerve fibers in the eye. Newer technology that utilizes laser scanning technology actually measures these nerve fibers. We call it nerve fiber analysis. Using this technology, a laser will scan the back of the eye, measure the health, the strength, and as well as the rate of progression or cell death if there is glaucoma present. This method is becoming widely accepted as the gold standard in monitoring for glaucoma. It can also detect changes many times sooner than traditional testing alone. Utilizing more than just one of these tests is crucial for your optometrist to understand the full risk of developing glaucoma. For more information about glaucoma testing, I suggest you speak to your optometrist, or go to Google and type in glaucoma diagnosis for more information.